What I'm hoping to bring to you in this DVD is assessment and treatment protocol for treating people with low back pain. Now, I know as well as you do that low back pain is as varied as days in the year. There are many causes, there are many reasons why. And so too, there are many assessments and many treatments for low back pain. I'm going to introduce to you treatments and techniques that are not just mine solely. I have worked with some of the best therapists, some of the best doctors around the world, and I have learnt from them. I'm going to bring to you a package that all of these doctors and all of these therapists have put together. I have put them into one little parcel and I use them in a clinical situation. Now, I'm not naive enough to think that my treatment and my assessments are the only assessments and treatments. They're not. But if you can use some of them, and some of my assessments and treatments help you to treat your patients, then that is a good thing. So what I like to do is lay my thumb in the laminar groove, and then I get my pisiform bone and I lay my pisiform bone on my thumb. Like that. And then what I'm going to do, I'm going to push this part of my thumb across the spinous process of each vertebra. So here we go. There's a spinous process, there's my thumb, my pisiform, and then very low grade mobilization going in this direction. So with my patient, I go palpating down the erector spinae over the multifidi muscles, and when I find a trigger point, I mark it with the tube of the acupuncture needle. And then I find another one, and another one. So I found 3 trigger points located in his lumbar spine. So what I'm going to do now is I'm going to swab the area and dry needle them. So again, get my swab. Okay. So we place our tube over the mark that we made. We spread the skin to distract our patient. Take a deep breath in, 1, 2, 3. And we stick the needle into the trigger point. I come between the last rib and the top of the ilium, and I feel that soft tissue. And I come down until my hands hit the iliac crest. I move my thumbs along the iliac crest until they're in the same position, and I look to see which thumb is higher than the other. So in this case, if the left one is high, that tells me that quadratus lumborum could be pulling that ilium up. Okay, so we're going to assess that. So I come into the soft tissue. That's the last rib. That's the iliac crest. And I can see the left ilium is high. So this is up. So it could be a tight quadratus lumborum. So what we're going to do now, we found we've got a weak glute max. So we need to re-educate that. So I've got my patient in a neutral position, not too much anterior pelvic rotation, not too much posterior pelvic rotation, but he's in a neutral lumbar. I asked him to activate his transverse abdominis and his erector spinae, and then I place my thumbs in his glutes and I ask him to squeeze his glutes together and pull towards his head. Okay, so he's having trouble activating this glute, so I'm going to try and give some stimulus to reconnect that neural loop. So I'm just going to tap on this area to open up the neural pathway, and then I'm going to stimulate the area. Take it into extension, take it in, hold, 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 relax. Hold, 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 relax. And so this is creating some neural stimulus, opening up the neural pathway. Hold, 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 hold. Relax. Hold, 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 hold. Relax. This DVD, I hope, has inspired you to go on and do more study, to challenge what you have learnt in the past and bring forward new techniques and new challenges. A master craftsman has many tools in his toolbox so that he can manufacture things. A good therapist has many assessments and many tools. So fill your toolbox with all these assessments and treatments and use them.